John, tell us a little bit about how early it really begins.
I'd be delighted to. Now, you taught me how to do this, but, oh, there it goes. So here are my disclosures. Unfortunately, these have not provided me any direct financial benefits.
I have to teach you about how to do better with it.
I know. So the point that I'm really going to make is that despite, there are something like 400 million people in the world with diabetes. It's 12% of adults in the United States. The lifetime risk is on the order of 35% for developing diabetes in the United States. There's an additional 35% of the population that has so-called pre-diabetes or abnormal glucoses associated with a high risk of developing diabetes. And I do think diabetes is the complications. It's a sort of accelerated form of aging. But I think the feature of diabetes that isn't always appreciated is that it really starts very early. So the pathophysiology, which I think my colleague Dr. DeFranzo will take a deeper dive on, is related to progressive beta cell failure, a failure of insulin secretion on the background of insulin resistance, which is relatively more static over time. But if you look in the children of parents with diabetes, the black bars here as compared to children who do not have relatives with diabetes. This is from the Bogalusa heart study, adjusted by race, gender, and age. You can see that even the 4-year-old children of people with diabetes have higher BMI, and more importantly, more obesity is assessed by subscapular skin folds. And if you look at markers of glucose metabolism, insulin levels, glucose levels, and a mathematical concatenation of the two that measures insulin resistance, HOMA-IR, you can see that even more substantial metabolic abnormalities in the glucose space are present from a very young age. And when you look at the sort of why is it that the children of parents with diabetes have these metabolic signatures, there's a lot of thoughts about why that might be, but there's limited evidence. And this is a very imperfect study, but it gets at a couple of points. So the black bars here are obese patients with gestational diabetes, and the sort of more densely hatched bars are obese patients with no gestational diabetes. And when you look at on the far right, the proportion of people in the offspring of women ages 18 to 27, you see that there is a difference in the proportion of patients with type 2 diabetes or pre-diabetes, and that difference between the black bar and the hatch bar is suggested to be the potential effect of the intrauterine environment, the difference in the rates of diabetes in the offspring of obese patients with gestational diabetes versus people who were screened for gestational diabetes based on risk factors but didn't have gestational diabetes. In the white bar, those are obese patients, the mothers were obese women with type 1 diabetes, so intrauterine hyperglycemia, and the more lightly hatched bars, the mothers were obese and had hypertension. And the notion is that the type 1 diabetes difference from the women with gestational diabetes in black also suggests the possible effect of intrauterine hyperglycemia, and the difference between the hypertensive patients on the right suggests the potential contribution of the genetic predisposition. So there are a variety of factors that are operative. It's not been well defined. It's been done in hundreds of studies. And nevertheless, the consequence is this this greater proportion of children now with diabetes, type 2 diabetes. It's still, thankfully, relatively rare, though a dramatic expansion in that population. It's about a bit less than 1% of children now affected with type 2 diabetes. The type 2 diabetes in children tends to be associated with greater insulin resistance, greater obesity, and more rapid progression of beta cell loss. The glycemic control with medications has proved very challenging, and complications have been shown to emerge early. And this is some data from the SEARCH study, population-based sample of children with diabetes diagnosed under the age of 20 and followed for 10 to 15 years. And if you look on the left column for type 2 diabetes, the proportion of patients that have evidence of diabetic kidney disease and peripheral neuropathy approaching 20%, retinopathy approaching 10%. And when you look at the adjusted odds ratio to the right, a clear indication that the rates of complications are higher in children with type 2 diabetes than what we would expect from looking at children with type 1 diabetes. So without specifically seeking to develop a haiku, can you move the slide forward? I can't. I came up with something that turned into kind of a haiku, and as opposed to really trying to make it into a haiku, I'll just leave it at type 2 diabetes is really a lifelong disease. We define it by glucose, but it has broad metabolic consequences, and the seeds of complications seem to be sown very early.